Good afternoon, everyone. We'd like to welcome you to the Caregiver Foundation and our Caregiver Support Group. I'd like to introduce Gary Powell, the Executive Director, and our guest speaker, Dr. Randal Suzuka. So, Gary, would you like to say a word?
Certainly. Welcome, everyone. We're so glad that you're joining us today, and we're so happy to have Dr. Suzuka back with us for what you call a third Pete. It's not it's a third Pete. So we always learn so much from you and really appreciate you taking the time to be with us today. This month, there's been a lot of feature on making sure that your advanced health care directive is done. So I want to encourage everybody to really take that seriously. You can go to kokoamau.org and get the forms, and the state has even developed a registry. So you can, for free, you can actually upload your forms onto that registry so that the emergency rooms and the physicians around town and around the state are able to get at those records in case you forgot them when you're taking that hospital ride or visit or ER trip. So, but do your family a favor. Make sure your advanced healthcare directives are up to date. Remember, you can change them when you need to, but keep them up to date and keep your family informed about them. So with that, I'm going to ask Dr. Suzuki just to take over and fill us in on what's going on.
Okay, so I was thinking, what should I talk about? And so I was thinking, well, let me go by what question I get asked about the most. And so I'm going to go ahead and talk. I only have one question in this. And so we're going to start the presentation. And this is the question. Doc, should I be taking Prevagen? Okay, so everybody comes in with their bottle of Prevagen asking me whether they should take that or not. Okay, and so let's see, is it advancing? We checked. Oh, there we go. Just a little bit of a delay. Okay, so I'm going to come back to this, but these are the things that have been shown to help prevent dementia, help preserve memory. And so we're not going to cover all of these because of time, but I'm going to try to cover the things that were most interesting. So we're going to talk about the MIND diet, avoiding ultra-processed foods. So we're going to talk about dietary things, social interaction, cognitive exercise, reminiscent therapy, exercise, playing musical instruments, use of hearing aids, maintaining your cardiovascular risk factors, avoidance of alcohol, tobacco, marijuana, avoiding of certain medications, getting enough sleep. And then even though it doesn't prevent dementia, we're going to talk a little bit about extra virgin olive oil, which is part of the Mediterranean or MIND diet. Okay, so this is from 2020. The Lancet Commission made a report on the things that work to prevent dementia. And there's a nice table here. And I'm going to turn all of you guys into medical students so that you'll be able to read these tables. So when we look at, it says relative risk for dementia and as parentheses 95% CI, that stands for confidence interval. And then we won't go through the rest in terms of the prevalence. That just means how frequent is this in the as a risk factor. But if you notice, for example, education, it says 1.6. So that means that people who have less amounts of education have a 60% higher risk of getting dementia. And the confidence interval, 95% means that just 2.5% of people have either less or more, that it's not beyond the level of statistical significance. But it goes from 30% all the way up to 200% benefit. We're not going to talk about education, although that's very important, because that's mainly for people that are under 45. Now, that speaks a lot to the importance of early childhood education, of people getting a good public education and other types of education, higher education. But by the time I'm talking to everybody here, we passed that benefit, so we don't have that as an option. So we're gonna kind of skip that, but that is an important thing. So we should encourage everybody to get a good, solid education. traumatic brain injury there's an 80% higher risk of dementia if you've had a traumatic brain injury. But we're not going to talk too much about that because none of us goes around saying hit me in the head, except for me when I said hit me in the head when we have a question. And so that's not something we can really do to prevent. It's just something that happens. We'd like to avoid it. And that does mean that sometimes we may be concerned if our kids want to play football. And then some of the other things like air pollution, there's a 10% increased risk of dementia with air pollution. And there is importance in us advocating to get rid of pollution, but that's not something that each of us have on an individual basis. So we're going to kind of look through all of these, and you can see that that some of the things have very high correlation, like hearing loss, oddly enough, has a 90% in correlation with dementia. Obesity and smoking has a 60%. Depression has a 90% increased risk of having dementia. So some of these things we'll talk about, some of them we will not talk about. And here's the ad that people see. I pulled this from the internet. This is a Prevagen ad. It's the #1 brain health support supplement in America. And you can't really see it, but there's a little box, and we can see it better on the next slide. But this is the ad, the TV ad for Prevagen. You can find it on YouTube. And it says that this is the #1 pharmacist recommended brand. And now you can see that statement that was in the box is a little clearer. It says, these statements have not been evaluated by the FDA. This product is not intended to treat, cure, or prevent any disease. Okay, so even though it says it improves memory, it supports healthy brain function, sharper mind, clearer thinking, none of those statements have been vetted by the FDA. I did find one study on Prevagen, and then also it costs about $1 a day. So you can get it on Amazon. 60 pills cost $57.21, and that's if you do it, and with those recurring subscription type of thing. Okay, so here's the study on Prevagen, and the component in it is apoaquarin. And the study did show that there was increased verbal learning in older adults in the community. But again, we're going to turn you all in, and we're going to look at this study a little bit more carefully. So it was a small study, 218 patients. One criticism is that it's self-reported memory concerns. So and they did do something called an AD8, which is a good estimate. We give that to family members if they have a concern about their family members' memory. But it's a self-reported thing, so it's not an objective thing like a mini mental status or SLUMS or Montreal Cognitive Assessment. It had met the buzzwords that we like to see. It's randomized, double-blinded, placebo-controlled. They gave 10 milligrams of apoaquarin or placebo. But note the duration of the study was really short, 90 days. 90 days only. Okay, so very short study. And it's statistically improved the international shopping list, ISL, and ISL delayed recall. And it was about 10% improvement versus 3.8% improvement in the placebo group. So not a bad one, but and the international shopping list is a validated score. It's 12 items on the shopping list, and you ask it 3 times, and you see how much of the things people can remember. So the measurement tool was reasonable, but we got to say that the duration of time was very short, only 90 days. There was some significant improvement, but maybe this is the most critical thing about the study. Everybody was supported by Quincy Bioscience in Madison, Wisconsin. So it's a company. So if you look at the article on the first page, it notes that all of the researchers are paid by the company. So that puts into a little bit of a question whether or not this is a valid study. And also the amount of improvement in 90 days, is that really significant and valid for only 90 days of treatment? Okay, so let's go into some of the things that have more evidence. So one is the MIND diet, and we'll come back and talk about what the MIND diet is. but this is from Alzheimer's and Dementia, the journal Alzheimer's and Dementia. And this was 923 participants age 58 to 98, followed for 4 to 5 years with food frequency questionnaire. And you might notice that the MIND diet, and MIND diet is a variation of the Mediterranean diet. And as many of you may know, the Mediterranean diet has been touted as the healthiest diet 8 years in a row. And the MIND diet is a variation of that. But the MIND diet reduced the risk of getting dementia, Alzheimer's, by 53%. Okay, that's better than most of the, that very expensive medicine that's like $100,000 doesn't do as good as the MIND diet. DASH diet was, that's one of the Mediterranean diet for hypertension. That reduced it by 39%. Mediterranean diet was reduced it by 54%. But only the MIND diet was effective at both the second and third tertiles, and the DASH and diet were only effective at the third tertile. I'll come back to that. I have a picture of what a tertile means, but basically the DASH diet, the MIND diet was effective even if you're in the upper 2/3 of people eating MIND diet, whereas Mediterranean and DASH diet were only effective if you're in the top third of people eating those diets. And here's another study from Alzheimer's and Dementia on slowing of cognitive decline with aging with the MIND diet. Same number of people, about 960 people from the Memory and Aging Project. And bottom line is that between the lowest amount of people adherent to the MIND diet versus the highest amount of people adherent to the MIND diet, that was the equivalent of being 7.5 years younger as far as brain health. Okay, so that's huge. And it was in 5 domains of cognitive function, including episodic memory, semantic memory, which is words, perceptual organization, perceptual speed, like cognitive speed function, and working memory. So in 5 areas of cognitive domain, there was a 7.5-year benefit in people who are eating the MIND diet. Okay, so here's the MIND diet. This is what I promised you. We go over what the MIND diet is and how it differs from Mediterranean and DASH diet. So the Mediterranean diet is high in fruits and vegetables, healthy fats. They use the healthy fats are things like nuts and olive oil, and they have some red meats. Generally, people eat fish and chicken with the Mediterranean diet. The DASH diet is a variation of Mediterranean diet that's more towards blood pressure. And the DASH diet, the traditional DASH diet is at 2,300 milligrams of sodium. If you get down to 1,500 milligrams of sodium, the DASH diet at 1,500 milligrams of sodium will reduce your blood pressure 20 millimeters, which is the equivalent of 1 blood pressure medicine. And then the DASH diet does allow red meat, alcohol. It limits pastries and sweets. I might mention that the average Mediterranean person eats 1 to 2 pounds of vegetables a day. Okay, that's how horrible our American diet is. A lot of times when I do 24-hour diet history, they'll say, oh, I had plate lunch, it had mac salad. So mac salad, by the way, doesn't count as salad. Mac salad, rice, I had chicken stew, and I go like, where's the vegetables, right? So like our American diet is horrible. If you think about that 5-pound bag of vegetables at Costco, one person would eat that in less than a week, right? 1 pound a day. One person should finish that 5-pound bag of vegetables in 5 days. Okay, so that kind of gives you perspective of how our American diet is, right? Okay, so MIND diet. MIND diet emphasizes olive oil and nuts. Nuts are healthy fats. So 1 handful of nuts will reduce your, 1 handful of nuts 3 days a week will reduce your risk of getting a heart attack by 7%. 1 handful of nuts 5 days a week will reduce your risk of a heart attack by 20%. Okay, it limits red meat, it limits alcohol, it specifies the kinds of fruits, which are berries and like strawberries, blueberries, cherries. It specifies the vegetables, which are more the green leafy vegetables like kale and the cruciferous vegetables like broccoli. So those are the types of vegetables we should be eating. Fish once a week. It limits fried foods. It eliminates fast foods and limits pastries and sweets. So that's the MIND diet. But the MIND diet, as we've seen, will give you 7.5 years extra of cognitive function. Okay, so here's the another topic on ultra processed foods. So what is ultra processed foods? It's anytime we add anything that you wouldn't add at home. It's colorings, it's flavors, it's other things like that. So this was a study out of Brazil, 10,000 people, ages 35 to 74. Mean follow-up was for 8 years. And again, that's the definition of ultra processed foods, not having flavors, colors, sweeteners, emulsifiers. And this one was divided into quartiles, so 4 sections. Okay, and compared to the first quartile, the people who didn't eat ultra processed foods, to the 4th quartile, 2nd through 4th, where people eat a lot of ultra processed foods, like the typical American diet, there was a 28% faster rate of global cognitive decline and a 25% faster rate of executive function decline when you're eating ultra processed foods. So we need to get back. I tell my patients, you can eat what you grow, kill, or catch. Okay, and try to avoid all the processed foods that we buy at the store. Okay, we need to get back to eating what we grow, kill, or catch. Okay, here's association with, we talked about socialization, we talked about cognitive activities. So here's a study out of JAMA Neurology on that. Okay, so this was 1,929 patients from Mayo Clinic. Average age at baseline was 77 years. And look at the results. So playing games, okay, so the kids are correct. We should be playing games, right? So playing games reduce the risk of dementia by 22%. Engaging in crafts. So that's why my mom is so smart. She's always doing crafts, but crafts reduces it by 28%. Computer use reduces it by 30%. And social activities, and they give examples of social activity in the study. They said going to the movies. So, you know, instead of paying $30 a month for Prevagen, you know, take your significant other to the movie a couple of times. But going to the movie reduce the risk of dementia by 23%. Social activities also include church or community activities or attending caregiver foundation functions. Okay, so by doing social activities, we can reduce dementia by 23%. Okay, so things that are much more enjoyable, much cheaper, spend your money on these things instead of Prevagen. Okay, reminiscence therapy. So this was an interesting study that was published back in 2018. So they took 60 nursing home residents and they randomized them to reminiscence therapy versus none. So the none actually, they got together. So the control group were people that met for 60 minutes once a week, but they didn't do the reminiscence part. Okay, so it's reminiscence therapy versus social gathering. And when the reminiscence therapy, they had people, they had assignments like, tell us about your childhood, what's your favorite childhood experience? Let's talk about some festivals. You guys remember when we had the Okinawan festival before or whatever, you know, talk about stuff from the past. Memorable travel, what's your favorite place that you've traveled to? You know, tell me something about that trip. Favorite foods, historical things, achievements. What things are you most proud about in your life? Music, important experiences, positive experiences, and your achievements. Hey, tell me about when you were working and you were doing this. What's the thing that you're most proud about in your job? So they gave people these assignments, excuse me, and they had them talk about these things. Okay, and then here's the benefit from that. So reminiscence therapy it improved the mini mental status score by 2.82. That's better than Namenda. Okay, Namenda will improve your mini mental status by 2 points. Aricept or donepezil will improve it by about 3. So it's almost as good as Aricept or donepezil. It improved dementia and it improved quality of life. So one of the things that I'll do for some of my older patients is I'll tell them, you know that box of pictures you have that you stored for your whole life? Take them out and start making a scrapbook. Okay, and then at the same time, go talk to your grandchildren and tell them about all of those things. Or if I have grandchildren, I tell them, go to grandma's house and say, Grandma, where's your pictures? Let's make a scrapbook. And then ask grandma, like, hey, what's this a picture of? You know, she might say, I don't know what it was. But, you know, make up something. Like, oh, was this where you went to school? When did you go on this trip? You know, what did you guys do? So have people reminisce about the past. Have them talk about it. But very powerful way to prevent dementia. Okay, physical activity. Unfortunately, we don't have as good evidence for physical activity. There was insufficient evidence that one activity prevented dementia, like walking or swimming or whatever, golf. But when there was low strength evidence that when you use physical activity along with diet and cognitive training, it did delay the cognitive decline. So we still recommend exercise. There is a hormone that's been discovered over the last few years called irisin that improves mental function, but we don't yet have studies that show the importance of exercise, but we still recommend exercise. Okay, here's an interesting study. Playing a musical instrument, okay, and later life cognition. So they looked at 5,693 people, and they measured, they looked at their frequency of playing a musical instrument, and they measured cognitive function 4 to 11 years later. The frequent musicians, which were defined as somebody who plays an instrument for an hour a week, had an 80% higher odds of being in the top cognitive decile. Okay, musicians at any frequency had a 29% higher odds of being in the top cognitive decile. So rather than taking Prevagen, play your musical instrument. Okay. Anticholinergic drugs and risk of dementia. I mentioned several drugs, alcohol, marijuana, and the benzos like Ambien and Zolpidem and Alprazolam. We're not going to talk about them too much, but this one you might find interesting, anticholinergic drugs and risk of dementia. Okay, so this was out of the UK Clinical Practice Research Data Link, 40,700 people, 770 people with dementia, 282,933 patients without dementia. The risk of dementia was 11% higher if you took an anticholinergic cognitive burden class 3 medication. We're going to show you those lists in the next slide, but it's an 11% higher risk of dementia if you are taking these medicines regularly. And here's the list. So Dimetapp, Benadryl, oxybutynin or ditropan, Detrol, so a lot of those medicines that people take for bladder relief, Bentol, Antivert, Transderm scopolamine, and a lot of people with Transderm scope, they'll use it like for a trip, like once a year, that's not a problem, but scopolamine on a regular basis is going to be a problem. Some of our antidepressants like amitriptyline, nortriptyline, doxepin, and Paxil. So those are all the ones that have a higher anticholinergic burden, and they are associated with an 11% higher risk of dementia. Here's an interesting report from the United States Preventive Services Task Force at the end of last year. And they still recommend that you don't use estrogen to prevent medical problems. We can still use it to treat. If somebody has hot flashes, we still can use it to treat, but we shouldn't be using estrogen to prevent problems. So it gets a D recommendation for use of estrogen. And I made the table. This is not just for memory, but these are the reasons the United States Preventive Services Task Force recommended against routine use of estrogen to prevent problems. Now, there were some benefits. There was a reduction in fracture, diabetes, and colon cancer, but the risk of death breast cancer. So there was like a 21% reduction in fractures, a 19% reduction in diabetes, and a 38% reduction in colon cancer. But there was a 24% increased risk in breast cancer, 87 to 90%, 98% risk of embolic problems. The dementia was interesting. 200% increase in dementia with use of estrogen. The other one that was surprising to me was urinary incontinence was actually 50% higher, because I would have thought that urinary incontinence would be better with estrogen, but it was actually 50% higher when people were using estrogen. So we probably have to be cautious about using estrogen because of the risk of dementia with estrogen-containing products. Sleep. Okay, this is one that I'm going to get dementia because I don't get enough sleep. But here's an interesting slide. The best was this is amyloid plaque burden. As you know, amyloid has to do with Alzheimer's disease. And the best was at 8 hours. So if you can sleep 8 hours, then you're going to, and 7 was also pretty good. But it actually goes up after 8 hours. So if you sleep too much, you get an increased risk of dementia. And if you sleep too little, then you have a higher risk of dementia. So the sort of the sweet spot is at 8 hours of sleep. It seems like the brain needs 8 hours of sleep to clear out all the junk that deposits in the brain. Okay, and then this is the last things that we're going to talk about: olive oil. So this does not have to do with prevention of dementia, but I just thought this was so interesting. So this was published in the Journal of the American College of Cardiology last year in January 2022. And this was from the Nurses and Men's Professional Follow-up Study. So looking at like 90,000 people, and this was by food frequency questionnaire every 4 years. And basically they looked at taking 0.5 tablespoons, that's like a teaspoon and a half of olive oil versus no olive oil. And here's the results. There was a 19% reduction in all-cause mortality, 19% reduction in cardiovascular mortality, 17% reduction in cancer mortality, that's kind of surprising, and a 29% reduction in death from neurodegenerative disease, and an 18% reduction in respiratory disease mortality. So half a tablespoon of olive oil has tremendous benefits, and that's actually part of the MIND diet. Okay, and here's our summary side. Again, you notice that I do not have Prevagen listed in the list of things that you can do. But again, we have MIND diet, social interaction, cognitive exercise, reminiscence therapy, exercise, play a musical instrument, use hearing aids. Remember that had a 90% higher risk of dementia if people have trouble hearing. Maintain your blood pressure. And for dementia prevention, we actually have to shoot for 130 systolic. Glycemic control, avoiding alcohol, tobacco, and marijuana, avoiding medicines like Benadryl, Zolpidem, Alprazolam, NSAIDs, estrogen. Try to get at least 7 hours of sleep, preferably 8 hours of sleep. And then separate from everything else, but a good idea anyway. And part of the MIND diet is take half a tablespoon of extra virgin olive oil every day. Okay, and that takes us to the end of our presentation. And I see there's some questions in the chat.
Yeah, so doctor, I can help with that. Would you like
Okay,
to,
sure, great.
would you like, oh, I guess you could leave the slide up. Oh,
Oh, these are, okay, let me put it back up. Which
but
slide did you want back up? Did you want the summary one with all the stuff on it?
it's very helpful.
Yeah, let's see if I can get, there we go, okay.
Questions from the,
Okay,
so
go ahead.
let's see, about sleep. I think this is very common for a lot of us caregivers, is trying to get to sleep, trying to get enough sleep. So the question is, the 8 hours, is that a straight night's sleep? Or sometimes there's interruptions. Sometimes we take naps. You know, is it a
Right.
8 hours during a day? Or
Yeah, I think they did not specify, but I think ideally it would be 8 hours at a crack. Now, because you know, again, if we go, and we don't know for sure, but if we go with the thought that you take it takes time for the brain to clear out all the junk that's accumulated in it. Like a 20-minute nap during the day might not accomplish that. So it might be more of that 8 hours total. We do actually recommend people not take a nap in order to sleep better at night. So that's one of the things that we recommend. That's a whole nother talk in and of itself, like sleep hygiene and cognitive behavioral therapy for sleep. So, you know, not drinking any caffeine products after noontime, not staying in bed for more than 15 minutes at a time. If you can't sleep, go out of the bed. Do not watch TV or read in your bedroom. Don't use laptop, tablets, phones, etc. right before bedtime, because you know it stimulates you. If you do, try to keep a blue light filter. There are the cognitive behavioral therapy is the best treatment for trouble with sleep. You actually, and we said you don't want to use Zolpidem because that's going to increase your risk of dementia. But using cognitive behavioral therapy, and there's an app for that from the VA called CBTI Sleep. But that would be another topic on itself, would be preventing insomnia and getting to sleep.
Yes, especially for caregivers and the multitude of responsibilities we have during the day.
Yeah,
there's
that's a tough one. That's a tough one. So all of us are going to get dementia because of the sleep problem.
oh no. Perhaps we're doing enough of the other strategies on the summary slide that
That's right. That's right. You only can do what you can do. That's correct.
There's a comment. Dad has Alzheimer's and used to play the piano, but no longer interested. We play oldies music on Pandora for him, and he sings along and remembers his songs. So that's an interesting question. How about singing or just listening to music? Any studies about that?
No, I haven't had any studies, although we do have evidence that music does help the behavioral changes from dementia. So, you know, people that are agitated, you know, and things like that. So we do have evidence for music therapy for that, and depression. So we have good evidence for that. We don't have evidence yet on treatment or prevention in terms of just music. You know, it's a little bit tricky, and they did not specify the type of musical instrument. I've always kind of suspected that musical instruments that make you use two hands separately, like the piano, for example, or you know, guitar or something like that, where one hand is doing something, the other hand's doing something else. And I don't have any evidence for this, but I think that there's a part of the training the brain to be able to do two different things at the same time that might be helpful. Again, I don't have any evidence for that, but I think that it would be interesting to see if people can break down, is there a difference in the type of musical instrument that people play? But right now we don't have, and it could be the mechanical thing of using your hands, using the brain, having to, and it doesn't say whether you have to read music or just play by memory, but all of those different factors I think would be interesting to see if we can break down what are the things that are the most important in preventing dementia.
Okay, a comment, and I have a client who fell forward, hit his head on the pavement. He developed dementia from that time on. So I know you spoke about traumatic brain injury briefly in the beginning, but could you elaborate just a little bit more about injuries that might lead to?
Okay, so when we look at brain injuries, it runs the whole spectrum from a concussion to a traumatic brain injury, right? So if somebody, you know, gets their bell rung, so to speak, you know, and you have some lightheadedness, headache, nausea, photosensitivity, but you had, and if you had a CAT scan or MRI and it's negative, okay, we call that a concussion. That's where we have a change in function secondary to a mechanical event, not from alcohol, or drugs. Okay, change in brain function from a mechanical event with no structural damage to it. Okay, that's a concussion. And even concussions on a repetitive basis have been shown to increase the risk of dementia. So that's sort of on the mild end, right? Somebody who gets concussions. There was one study showing that, I forget the exact number. I think it's if you hit the ball more than, I think it was either 5 or 7 times in soccer, there was an increased risk of cognitive dysfunction. So my poor son, when he was playing soccer, he probably was the only one that where everybody else was going, good hitter, Aaron. My wife was going 1, 2, 3. She would be going like, Aaron, you gotta stop hitting the ball after you hit whatever the number was. But mild concussions even can cause a problem. And then you go all the way up to the traumatic brain injury, right? Where you fall down and you get bleeding in the head. Now, certainly, the more traumatic the event, the higher the risk of having dementia. And then we also know about those football players that have multiple concussions, and they have the traumatic encephalopathy later on in life. So it runs the whole spectrum from concussions to, so a single traumatic event might throw somebody into dementia. And I actually also have a patient like that who fell down, had a pretty bad, traumatic event, little bit of hemorrhage in the brain. Not horrible. He didn't have to be intubated or anything else, but his memory has been shot since that time. Also infections. So I had one patient who had encephalitis one time, and after that, his memory is shot. As we get older too, we have less resiliency. We don't have as much wiggle room. So a traumatic event in a 10-year-old might not be as devastating as a traumatic event in a 9-year-old.
Okay, there's a question about melatonin as a sleep supplement. So is melatonin okay?
Yeah, melatonin has been okay to take. It has not been shown to have any cognitive or other problems. The dose is generally in the literature 1 to 5 milligrams. Usually, I think you pick it up at 3 milligrams. So we tell people, 3 or 6 milligrams. I have not seen it in older people, but there was a warning for young kids to avoid taking melatonin. But I think that would be the only concern I'm aware of is in kids taking melatonin. But in adults, we tell them between 1 and 5 or 3 to 6 milligrams, something like that, for if they want to use it.
Okay, you've gotten a little bit soft at the mic. Perhaps there's been a change in positioning.
Yeah,
Oh, that's good.
that's better now? Okay.
Wonderful. So
Okay.
comment about education. You mentioned that the ship has sailed for most of us regarding. However, is it possible to gain benefit from learning new things? Activities that require memorization, the music lesson, and so forth. Is there any benefit at an older age to take on this new learning?
Yeah, I think there is. Unfortunately, we don't have good solid data on that, but we do have some data. And so I think that would be important. And one of the studies that's real interesting is the nun study, that like the Catholic nuns. And they looked at the nuns, and the nuns who are journaling actually had less cognitive decline than the nuns who just did reading or other things like that. And I think learning new things, doing cognitive exercise, I think we have some make sense kind of thought, and it doesn't hurt. It doesn't hurt for somebody to learn things and do all that. So I would encourage people to do that, but we don't have as good evidence. You need big studies, and it's kind of hard to pick what you're going to teach people to learn. So that's going to be a hard study to do. But that would, I think, intuitively it makes sense. That's cognitive exercise, and I think that would make benefit. So, but we don't have as good evidence with some of these other things.
And then one more question. Can you elaborate on dementia and depression?
Okay, so, and it goes both ways. A lot of people that have dementia also get depression, but also depression can lead to dementia. And it could be many different factors. It could be complex because the person who's depressed, they're probably not going to interact socially. The person who's depressed probably is not going to be physically active. The person who's depressed is probably not going to play games or do other things. So the depression may act as a problem, but also it could be that the nerve transmitters that get messed up in depression also predispose people to dementia also. I think it's going to be complex with the depression side, but and we don't have great evidence that by using antidepressants we're going to prevent it, but I would think that's a logical conclusion, that we should not let people stay depressed and we should try to treat their depression. And again, it doesn't hurt to treat the depression, but it may help prevent the decline in cognitive function.
Okay, so I just have, I have another question. This will be our final question. So on the summary slide, I counted up 12 life strategies. So if you were to choose the most important or one where we could start and then maybe, move on to others on the list, which one would you choose? Like a starting?
Okay. I would probably pick, it's kind of a toss-up. Can I do like top 5?
Great.
Sure.
Okay, so I would probably pick mind diet and so dietary interventions, right? Because we have to eat, and it's a matter of what we're going to eat, and we might as well pick a good diet, and the benefit from that is huge. So I would probably pick that as a top 5. I would probably pick controlling cardiovascular risk factors as another one. Because also if we have high blood pressure and diabetes, we're going to have a higher risk of getting strokes and other things. So that would be number 2. I would probably pick, what would be another one? I would probably pick sort of lumped together the social interaction aspect of it, and that includes like play and and all of those kind of things. And then I would probably pick avoiding the bad stuff. And I'm gonna cheat because that actually has 2 lines to it. But avoiding all of those things that make a problem, that would be good. Maybe that's just a top 4 things that I might do.
Okay, we had a comment in the chat about please share these wishes with your loved ones, your power of attorney. So Dr. Suzuka, I'm always so impressed after one of our sessions, such a wealth of information and so much to take home with us.
I hope you remember it.
This slide we will share through the Caregiver Foundation.
Okay.
Means. Gary, would you like to say anything to close? And we also invite our caregivers to stay on the call afterwards for some caregiver sharing and support. But Gary, would you like to say anything in closing?
Well, Dr. Suzuka, I always learn every time I hear you or am anywhere around you. You always are full of great information. I appreciate you sharing it with us today. I'm going to go home and drink olive oil. No, I suppose it's okay to put it on salad rather heavily.
Yeah.
Okay. Great. Well, I can see some things that I'm going to try and incorporate into my daily lifestyle, and I'm sure other folks are benefiting from that as well. So thank you very much.
All right. Thank you very much, Dr. Suzuka. You have a great day. Thank you.
Okay. Yeah.